Ladies and gentlemen, today, I stand before you to talk about a topic that many seniors and their families are struggling with. Should we move into a nursing home? Many people believe that nursing homes are a safe place, providing seniors with a comfortable life and full medical care. But is that the whole truth? Or are there hidden corners that we have not really seen? First, nursing home costs a huge financial burden. Nursing home costs are a huge financial burden for many families, especially as people's life expectancy increases, leading to an increasing need for long-term care. In the U.S., the cost of an average quality nursing home ranges from about $9,000 per month, equivalent to $108,000 per year. This number can be higher in large cities or high-end care facilities. For those with Alzheimer's or Parkinson's, the costs increase significantly. Many seniors do not have enough income or savings to cover these costs for many years, leading to the need to sell assets or rely on their children. A common misconception is that Medicare will cover the entire cost of a nursing home, but in reality Medicare only covers short-term costs, up to 100 days, after a hospitalization. For long-term care needs, seniors must pay for their own care or rely on Medicaid, a program with strict income and asset requirements. In this context, some viable financial solutions can be considered, such as long-term care insurance, LTCI, but not everyone is eligible or can afford it. Some families plan to transfer assets before needing a nursing home to qualify for Medicaid, but this must be done under strict regulations. In addition, home or community-based care models are also becoming popular options to ease the financial burden. Nursing home costs are not only a financial issue but also affect the quality of life of the elderly. Does a person who has worked all his life deserve to spend all his assets just to pay for his final years? This is not only a personal story but also a social issue, raising questions about the responsibility of the government, family, and community in ensuring a fair and sustainable healthcare system. Without long-term financial planning, many elderly people may face the risk of losing both assets and freedom. To solve this problem, there needs to be coordination between individuals, families, and the policy system to reduce the burden and ensure a safe and happy life for the elderly. Second, service quality, not always as expected. The quality of service at nursing homes is not always commensurate with the amount of money that the elderly and their families spend. According to statistics, about one-third of nursing homes in the U.S. have been found to have violated safety and healthcare regulations. These are not small mistakes, but in many cases, they lead to serious consequences, directly affecting the health and spirit of the elderly. One of the biggest problems is the lack of staff. When the number of caregivers is not enough, the elderly can be neglected for a long time, not receiving timely support when needed. Delays in care can lead to infections, bed sores, malnutrition, or even death. In some worst cases, there have been reports of violence and abuse in nursing homes, from physical violence, mental abuse to improper medication management. We cannot simply trust that there will be someone there to take better care of us without careful verification. If the wrong place is chosen, the elderly will not only lose their freedom, but also their dignity and respect. Isolation in a nursing home environment can cause them to become depressed, lose their will to live, and not be listened to. So how can we avoid this risk? Families and the elderly themselves need to proactively learn and evaluate carefully before deciding to entrust their lives to any facility. Important factors to consider include the staff-to-patient ratio, reviews from monitoring organizations, feedback from relatives of patients there, as well as the actual experiences of the elderly themselves. In addition, government monitoring and sanctioning policies need to be implemented more strictly to ensure that all facilities comply with healthcare standards and respect the rights of the elderly. The quality of service in nursing homes is an issue that cannot be taken lightly. It not only affects physical health but also determines a person's respect, dignity, and quality of life in the final years of life. Therefore, the selection and supervision of nursing homes should be considered an important and responsible decision, not only for the elderly individual but also for the family and society. Third, loneliness, a serious mental problem. Let's ask a simple question: do we want to live the rest of our lives without our family? The answer is definitely no. However, the reality is extremely cruel. Up to 40% of the elderly in nursing homes have few or no relatives to visit, which means millions of people are experiencing lonely days, being forgotten, no longer feeling the warmth of family. Imagine an old man sitting by the window, looking out, wondering, where are my children and grandchildren? Do they still remember me? It is not just a fleeting sadness but a dull pain, gnawing at their spirit and health every day. When old age comes, health declines. People not only need medicine or a reasonable diet, but more importantly, connection, love, and a sense of belonging to family. Nursing homes can meet material needs, but they cannot replace family affection. A timely meal, a clean room, a comfortable bed all become meaningless without the care of loved ones. A smile, a hug from children and grandchildren is more valuable than hundreds of meals served on time. Research has shown that loneliness has a negative impact on the mental and physical health of the elderly, increasing the risk of depression, anxiety, memory loss, and even leading to early death. When there is no social interaction, the brain gradually loses its flexibility, causing the elderly to fall into a state of resignation and lose the will to live. So how to solve this problem? Families need to maintain a connection with their loved ones in nursing homes by regularly visiting, calling, or sending a letter or a photo. Nursing homes need to create a positive social environment, organize many community activities to help the elderly have the opportunity to interact, connect, and feel cared for. Society needs to change its perception, not considering nursing homes as the place to send the elderly away, but as a place to support and accompany families in caring for their loved ones. Loneliness is not just a feeling but a mental illness that can kill a person's will to live. When we are young and busy with life, we can forget that one day, we will also grow old. And at that time, what we want is not a luxurious room or a nutritious meal but warm moments with family. Don't let our loved ones spend their old age in loneliness and forgetfulness. Fourth, loss of autonomy, no longer being yourself. One of the most painful things about entering a nursing home is losing your own freedom. When we are young, we are used to deciding everything in our lives, from our living hours, favorite meals to our daily activities. But when we enter a nursing home, everything changes. Wake-up times, meals, rest time, even going out all have to follow the rules. Many elderly people who have lived their whole lives independently, in control of their lives, are suddenly bound to a rigid framework. They can no longer choose the food they like, cannot freely go for a walk when they want, and sometimes even the simplest decisions like what to wear are limited by the schedule of the care staff. This loss of control makes them no longer feel in control of their lives, leading to depression, loss of motivation to live, and gradually becoming indifferent to everything around them. Not only that, in many nursing homes, to ensure safety, the elderly are also limited in contact with the outside world. Being confined like a child makes them feel like they are just existing, not really living. They are forced to accept the arrangement, live a life that is not their own, and gradually lose themselves. Losing autonomy affects not only the mind but also the body. When they no longer have the freedom to move and make decisions, the elderly become more passive, their memory declines faster, and their health also declines. Many studies show that maintaining independence helps the elderly live longer, happier, and have a clearer mind. When deprived of autonomy, they fall into a state of resignation, lose the will to live, and old age becomes a series of repetitive, meaningless days. So what is the solution? Nursing homes need to create a more flexible environment that allows seniors to have more autonomy in their daily lives. Families need to visit regularly and listen to their wishes instead of just letting them adapt to the existing system. Most importantly, society needs to change its view of the elderly. They are not people who need to be completely controlled, but still individuals who have the right to decide their own lives. Losing autonomy is not just losing small daily choices, but losing identity, honor, and even joy in life. For an elderly person to be able to live their final years to the fullest, they need to be empowered to decide about their own lives, instead of being put into a lifeless framework. Because living is not simply about existing, but being in control of one's own life. Fifth, do we have any other options? The answer is yes. Nursing homes are not the only option, and in many cases, they are not the best option. Instead of placing seniors in an unfamiliar environment, losing their freedom and family connections, we can absolutely find alternative solutions that help them receive attentive care while maintaining their quality of life and optimism. One of the best options is to hire a home caregiver, helping the elderly to have the necessary medical care while living in a familiar environment. Living in their own home helps them feel safe, not stressed by sudden changes, and can maintain their daily routine. Moreover, this also helps them maintain their independence, not constrained by the rigid regulations of nursing homes. In addition, today there are many professional care services, from nurses, medical assistants to people who can help with daily activities. Families can flexibly choose the level of support that suits their needs and budget, instead of paying a large monthly fee to a nursing home without ensuring quality of service. If possible, living with children and grandchildren is the option that brings the most mental benefits. Nothing can replace family affection, and for the elderly, being with children and grandchildren not only makes them happy but also has the effect of prolonging life, reducing the risk of depression and dementia. However, not all families have the conditions to care for elderly parents. Modern life is busy, making it difficult for many people to have enough time for their parents. In this case, a combined solution can be found, such as sharing responsibilities among family members or hiring part-time caregivers. The important thing is that the elderly do not feel abandoned but still have a connection with their children and grandchildren in their daily lives. An increasingly popular model in many developed countries is to build supportive communities, where seniors can live independently but still have help from friends and neighbors when needed. Instead of staying in nursing homes with rigid rules, they can choose to live in residential areas for the elderly, which are fully equipped but still ensure privacy. This model helps them maintain their autonomy, maintain social relationships, and not feel isolated. In addition, many communities also organize common activities such as clubs, gyms, and arts, helping seniors have a happier and more meaningful life. Instead of waiting until there is no other choice but a nursing home, we need to plan early. Each family should discuss and learn about suitable solutions, from financial planning, purchasing long-term care insurance, to building a family and community support system. No one wants their old age to end in loneliness and loss of freedom. If we can prepare early, we can proactively create a more meaningful, fulfilling, and happy old age. A nursing home is just one of many options, but if we can stay at home, with our family or in a friendly community, that is still what most of us want. Dear all, a nursing home is not a bad choice, but it is not the only choice. Before deciding, consider carefully. Do I really need to go to a nursing home? Can I afford to live there long term? Are I willing to trade my freedom and family affection to go there? Remember, happiness in old age is not just having a place to live, but having a life worth living. Thank you. Don't forget to like and subscribe, so we can continue sharing helpful advice together. Thank you for watching, and I'll see you in the next video.